For many parents, there's a terrifying gap between weekly therapy and full-time residential care. What if the next level of care wasn't for extreme cases, but the perfect step for teens needing more support? There is a treatment model that provides the intensity of a hospital program, but still allows your teen to sleep in their own bed every single night. This is PHP, or partial hospitalization. We'll show you what it is, how it works, and why it is so effective. So, what exactly is a partial hospitalization program? Think of it as the missing middle rung on the ladder of care. It perfectly bridges the gap between weekly outpatient therapy and 24/7 hospitalization, providing intensity at home. It functions as a step up when outpatient care isn't enough, or a step down from a hospital stay. A typical day is a full approach: individual, group, and family therapy with medication management. Teens get 4 to 8 hours of daily treatment 5 days a week, building momentum for change. And school? Most programs have academic support with tutors to prevent students from falling behind. This all sounds supportive, but why is going home nightly the component that makes it so successful? The program's true power lies in its practice and report cycle. Teens learn coping skills during the day, and that same evening, they apply those skills in their real environment with their actual family. The next day, they report back to therapists on what worked, creating a feedback loop that makes skills stick. This structured, predictable daily schedule also creates safety. For a teen in chaos, this stability is therapeutic. So who is this intensive, real-world approach best for? It's for teens with severe challenges in daily life. This can include school refusal due to anxiety, or debilitating depression that paralyzes their ability to function. Significantly, it's for the teen feeling totally alone. In group therapy, they meet peers who truly understand them. So that unique advantage we mentioned? It's this combination: intensive therapy, peer support, and immediate practice. The work is grounded in proven methods like CBT and DBT, giving teens concrete tools to manage their thoughts. This is not a temporary fix. Early, intense intervention during adolescence improves long-term recovery outcomes. If PHP is so effective, why are so many parents hearing about it for the first time? The barriers are based on myths. First is the stigma of intensive mental health care. Parents fear judgment, which stops them from asking for help. Second is the belief that adolescent mental illness is just a phase. Waiting often makes conditions worse. Third is the fear of cost. Yet PHP is often more affordable than residential care because it lacks 24/7 housing. The single most important factor for success might surprise you. You, the parent. Your involvement is key. Remember that practice and report cycle? The family home is the training ground for new skills. PHP addresses isolation from 2 directions. The teen finds a community of peers, and parents get professional guidance. This complete approach, treating the teen and involving the family, is what creates lasting, meaningful change. So, how do you know if PHP is the right next step? If you feel stuck, it's time to ask the question. Partial hospitalization is a targeted, powerful level of care, not a last resort for your child. It's more than weekly therapy and less disruptive than residential, focused on skills that work in the real world. If your teen needs this level of care, you have not failed. You are succeeding by finding them the right help. Start the conversation. Talk to your teen's therapist or school counselor. Ask, could a PHP be right for my child?